So I guess, oh, Dr. Biden, don't leave. Go to the bathroom line. I'm by myself here. I guess what I was going to say was that I've happily had this conversation about open notes, and people said it'd be nice to have people who've actually done it or tried it to share their experience. The question of like, what did change about your documentation? So I was going to ask Dr. Leiden, in that he was on the top, even though I'd be on the top if we double my FTE, but that he always kept down by a white guy. I'm just kidding, sorry. So that just expressing what changed about your language in this first 2 weeks in your documentation?
I think the most that's changed is in my subjective. I've tried to be more specific in, I guess, typing as I go and telling patients, turning the monitor towards them, documenting what they're saying essentially, and kind of making a point of saying, I'm writing down, just trying to catch everything that you're telling me. So I've changed kind of how I do my subjective. Sometimes I'll actually use the note writer feature a little bit more because it saved me some time and actually pulled in more words rather than more abbreviations, because the words I think will probably be more intelligible to people. I was a late adopter of note writer, so I've been using that a little bit more. And I think more for the clarity, not for the necessarily time saving, but just so it puts more words in there easy to understand. The assessment plan I've actually probably not changed very much because I've tried to long-term do the easy to understand, do it in the visit, and then copy and paste that exact thing into the ABS. So
it's actually been fun for me. I don't know if it's sort of like going back to medical school and following the rules that I was supposed to be following all along about clarity, and I did change my F/U. That was the abbreviation that I changed. I do the same thing with subjective, and I type it as I go, and I recap it with the patient, and then I get everything. And then if you have a pen in front of you, write down this mark link .copy PI. .copy PI. Half of you know it, half of you don't know about this. But if you put in your plan, which you were already patient-facing, in the after visit summary, in the patient instructions, and then you go back to your note under your plan and you do .copy PI, there's no copying and pasting, it just pulls it right in, and it's refreshable. So you're like, oh, I forgot to tell you about that bacitracin thing. Then you add it, and then you just refresh your note, and it pulls it in. It's like the best, fast time saver for building your plan. .copy PI.
I just wanted to, again, respond to your original question about folks who where English isn't their first language or they might not be native English speakers. There is a study that's going to be published any moment now that we don't have yet linked on our website specifically about that. So again, go here or sign up on the Open Notes email list, and every time something new is published, we do send that out. So, yeah.
So when you hit that button that Dr. Passman was so gracious to show us, it will mark that for release, and then when you sign that encounter, when you close it, it should all go out to the patient's My Chart like it normally does today. They should see their ABS and things like that. Now, if they have the access to it, which I think we've released it to all but our adolescent patients, proxies, they will be able to go in and see their ABS, and there's a second tab there called Notes. They can click on the note and they should be able to see it there. If they're still not seeing it, we can talk about it more, and you can contact me either through ServiceNow or just send me an email, say, hey, we have a lot of patients who are having complaints, they can't see their notes and they want to, and I'm releasing them and they're still not there. Please let me know so that I can make sure that it gets fixed if something's actually not working the way that it should.
I think also because we've kept it such a good secret, it's not actually intuitive, and we haven't trained any of our patients in finding those notes in My Chart. And so, sorry.
No, what you're saying is basically, yeah.
So, I mean, I think the question to the group, and I think us as a medical group, as an organization, is when do we come out of the closet about this? When do we make it actually something possible for patients to find and so that they know about it? I've been saying, every person I've released, I always say, hey, you know, I'm going to release this. It's a new functionality. It's kind of cool. If you take a look and you find something that you know that you have a question about, please let me know. I really want to hear back from you. And I haven't heard back from anybody yet, by the way.
So out of the 80 health systems that are on our website listed as sharing the notes are the ones that are out of the closet on sharing notes. There are so many more that we know of. They're like, don't ask the website yet. We're not ready to really communicate and market that to patients. Yale Health, specifically for faculty and students of Yale Health, are now sharing notes. And something they did that was really great is they had a whole website of, here are the screenshots, here's how to get to your notes. And then when they send out that email saying your notes are available, it's like, need to find your notes, click here, and they find that tutorial. So, I mean, that's something, as a communications person, I think would be done in advance, but as you're starting to let people know, that could be done. It's so simple to make those screenshots for people with a circle saying, click here for notes, here's, you know, the visit, here's the notes. So.
Before I have some final comments, any other questions for Liz? I think you'll find Liz in the hallway after this, too, if you have one-on-one questions for her. I want to just highlight the handouts that we had at the front desk. If you didn't pick them up, they're there. I also have spare copies of a lot of the primary research that Liz wrote, some of the articles in my briefcase. So if you are dying for one of the better articles or more deep articles, let me know. This is one of the suggestions. She's just talking about documentation. I'm not going to go over that. The other handout on the back side, I just want to call attention to the starter guide for amendments. I think in planning this, we heard right away from people, what are we going to do when patients call asking to amend or change their note? Not just questions about how to get the referral or coordination of care, not complaints about, you know, the lighting or not washing our hands, but actual about the documentation. So it's a starter guide, and so take the time to look through it. The trainers have communicated with the reception staff, call center staff, about how to handle any complaints that come in that way or amendment requests from that. The nursing staff is information is being shared with the nursing staff on how to process my charts or phone calls. We're not expecting a lot, but it will happen, of course, and it should, because we don't make perfect notes, and people should be able to feed back to us. So I do want to highlight that. The last thing on the table, during the break, there's a bunch of plain pieces of white paper. In the past, we've had the physician engagement panel come and bring a topic like this and run roundtables, and they have like shared their thoughts and like their what's come out of their great discussions. I want to give the opportunity for people to like write down questions or thoughts or feelings about open notes. Leave them on the table. Kathy will collect them, and this will be starter conversations that we will share with PEP next month, because PEP is going to be talking about open notes more next month. And that's where we're going to build consensus. But if you want the opportunity, you know, of course you can talk to your teammate who is on the provider engagement panel. So reach out to them directly, but if you want to just comment notes, I have starter questions or ideas or thoughts to consider when you're thinking about open notes, but feel free to kind of be ad-lib about it. The last thing is I think all of us who are kind of participating in the workflows on this really want to acknowledge the feels about all this. Everybody goes through their change process, you know, the initial shock. When one of the other healthcare organizations in town had a press release about open notes that was in the newspaper, I was out having dinner with Francesca and Renee, the Poke place on Monroe Street. It's really good. And we happened to bump into Dr. Rudy. And Dr. Rudy came up to us and said, "Did you see what was in the paper? I had a GI malfunction." This was about 2 weeks after I had my own GI malfunction, not just about doing open notes myself, but also in standing up in front of you here to talk about this kind of major cultural change. But it was amazing because by that time I had done a little bit of the reading, looked through the research, calmed myself down with some of the evidence, and realized all the benefits that Liz had shared, presented so nicely. And within like 3 minutes, he was like, oh, yeah, why are we not doing this? Like, you know, it was that kind of like evolution, like, oh, maybe this will be great. And I was like, I think you're going to be a proponent. So anyway, if you see him, see where he is in his change process too. But we want to acknowledge that this is a little bit daunting and scary and change is hard. But we also think that with the right values, the right meaning, and like asking ourselves, like, are we going to be the type of organizations that's going to be innovative in this way? Are we going to be the first? Are we going to be last in our community of healthcare organizations? The VA already for many years has released all the inpatient and outpatient notes through their portal to their patients. And I think that we'd be in good company working with the organizations that Liz has presented if we were in that group as well. So we're going to transition now. Did you have final comment, Dr. Cass?
Yeah, I just wanted to hopefully give Liz another round of applause for coming from California.